Going for a surgery in the operating theater may sound daunting. This video will help you prepare yourself for surgery so you will have a smooth recovery journey. We will show you how you can play a part in your recovery and what you can expect during your hospital stay. We hope this will make you better prepared, both physically and mentally, for the journey to recovery ahead. Your surgeon will explain the nature of surgery, its effects, purpose, potential benefits, risk, and any alternative option. We will also obtain consent for the surgery in addressing any concerns or questions that you may have. Following the consultation, our financial counselors will provide you with an estimated hospitalization bill and essential information. You may have to undergo some investigations, such as blood test, electrocardiogram, ECG, chest X-ray, etc. As part of your workup to the surgery, the results are carefully reviewed by our medical team to ensure your safety and well-being. Depending on the type of surgery and your medical condition, you may be assessed by a doctor or a trained nurse at anesthesia and pain clinic. This is to determine whether you are medically fit for the surgery. The assessment may include medical history taking, medical review, and physical examination. You will be advised to stop smoking and alcohol, stay active before surgery, eat well, and eat right. Your doctor or nurse will discuss with you on the different types of anesthesia, their benefits and risks. Here are the different types of anesthesia. The choice of post-surgery pain relief depends on the type of surgery, the anesthetist assessment, and your preference. Here are the various options for pain management. Preparing for major surgery is like training for a marathon. Regular exercise, even a 15 to 30-minute walk, is better than being inactive. Staying fit will help you recover faster from the stress of surgery and likely to return to normal activities more quickly. Additionally, getting enough rest is crucial. Smoking and drinking can cause complications and slow recovery after surgery. If you need help quitting smoking before your operation, please let us know. We are here to support you through this journey. Good nutrition is also key for a speedy recovery. Eat a balanced diet of rice, vegetables, meat, and protein sources like tofu and eggs to prepare yourself for surgery. Depending on the type of surgery, a dedicated nurse may speak to you if required. He or she will share with you more information on the surgery and how you can play a part on your journey of enhanced recovery. Besides, the nurse check with you on your discharge plans and address any concern that you have about surgery. You will receive a phone call from us 1 to 2 working days prior to the surgery to inform you on reporting time and location, and to remind you on important information about your upcoming surgery, such as fasting instructions and documents to bring along. You are advised not to wear or bring any valuables, for example, jewelry, accessories. On the day of your surgery, you will need to report to our Patient Service Center at Basement 1 for registration to enter via the gantry. You may then pass the gantry to take the lift at Tower B. Leave Lobby B to proceed to the short stay unit at Level 2. At the short stay unit, our friendly patient service associate will guide you through the registration process. Your height, weight, temperature, and blood pressure will also be taken here as part of your parameters for the surgery. We encourage you to hand over your valuables to your next of kin. After your registration is completed, our care support associate will bring you into operating theater prep holding. Once in OT prep holding, you will be taken care of by your nurse in charge. You will be assigned to a bed prior to the surgery and the nurse will provide you with instructions to change into the hospital gown. And your belongings will be kept safely. The nurse will gather information from you to ensure you are fit for the surgery. The surgeon and anesthetist will complete the final pre-surgery assessment and will perform site marking on your surgery site. The OT nurse will also verify and complete the pre-op checklist. You will then be brought into an area called Central Induction to prepare you for the surgery. In Central Induction, you will be transferred to the operating table. The anesthetist will set an intravenous cannula and administer medications to block or reduce pain, as well as discomfort that occurs during the surgical procedure. The anesthetist will provide the safest and most appropriate type of anesthesia and options for your surgery and pain management accordingly. In the operating room, your surgical team will ensure the readiness of the environment. Equipment and instruments needed for the surgery is ready. You will be kept warm throughout the surgery. Your surgical site will be prepared, and a final verification of your identity, nature of surgery, and site will be done prior to start of surgery. After the surgery, you will be sent to the Post-Anesthesia Care Unit, PACU, for close monitoring, and the nurses will provide support as you transit to the next phase of recovery. You might be given oxygen through a tube in your nose or a mask to help you feel better. You may have an intravenous drip, urine tube, or drains from your surgery site. You will be brought back to prep holding bay for your planned discharge. Light refreshments will be served, after which you may change back to your home clothes and retrieve your belongings. Pain is an individual experience and can vary from person to person. Your nurse will regularly check how much pain you are experiencing to ensure that you do have effective pain relief. Please inform the nurses or doctor if you experience any pain after your surgery. If you are admitted to ward, physiotherapists or occupational therapists may review you for post-operative rehabilitation. You are encouraged to start exercising as soon as possible to promote a faster post-operative recovery. You will be informed of your follow-up appointment details, and the prescribed medications will be dispensed. Your next of kin may then accompany you home. It's natural to feel worried before and after an operation. Please reach out to us if you have any concerns or would like to talk. We are here to support you through every step of your recovery.